This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and happy Mother's Day. Well, we'll have something to say on that in just a moment here. Good to have you with us as always. Health Watch Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, as you heard the man say, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. What do we talk about here on the show? The who, what, when, where, why, how, and anything and everything in between pertaining to innovative medical and how it can relate to you and your family and help you improve your overall quality of life. That's what we talk about here on the show. And if you have a question for Dr. Molly or you have a medical challenge at any time during the course of the show, 855-839-1210 is the number here in the studio. If you have a question, again, 855-839-1210. We should wish all the moms, Dr. Molly, a very happy Mother's Day.
Sure. And all the maternal folks in people's families who may not be physically be moms, but actually help nurture people and also help people in a way that only women can do.
Absolutely, and we should say that both of our mothers are no longer with us, but we had a couple of good ones, and in particular, you really took care of your mother.
I did.
The best story that I ever heard was, and I met your mom several times.
Of course,
I was in the clinic, and she said, "Well, I when I go home," she says, "I walk." And I knew she lived at 10th and Christian.
Yes, that's
and
right.
I said, "Well, where do you walk to?" She said, "I walk to Center City."
That's right. She would take. You know what she would do when she would come to the office. That's when we were in Cherry Hill.
Right.
She would actually take the train right from 8th and Market and get down to us in Cherry Hill. And then I had a patient at the time who was a wonderful guy. He had a cab service, and I arranged to take some other patients that way.
Right.
And it was a really nice thing, and my mother enjoyed it, and I feel like we added a lot of youthfulness to her later years.
Absolutely. I'm still thinking about that. 10th and Christian to Center City. I couldn't do half of that.
Well, it's 800. We lived 800 South, right?
Okay.
And when you think of that, that's allegedly about 9 blocks actually from Walnut Street, I guess, or Chestnut.
Yeah, so
it
was
great.
It was great. But a salute to all the mothers.
Actually,
and again,
here and now. And
exactly.
The other thing is, remember, John, your mom's still taking care of you, no
That's
matter what you say. And I had the pleasure of meeting your mother, and she was quite feisty, even in her later years. And, we used to talk about, things like osteoporosis, things that actually affected older women.
Yes.
She and I used to have a great conversation. And when we were doing the shows at that time from your particular palace, as I recollect, your mom was down there cheering you on, and it was great. It was nice. It was very nice.
All right, 855-839-1210 is the number, 855-839-1210, if you have a question or a medical challenge you want to run by Dr. Molly. And let's talk about, you took care of your mother and the hydration and all of that. So let's kind of go from the basics.
Sure.
Innovative Medical is about what?
Innovative Medical is actually a cooperative of healthcare providers, all working out of associates in preventive medicine, our facility. And we all can do anything that any other primary care practice can do. So you need a prescription, you're going to get a prescription. You need some consultations, you need some testing, radiology, lab testing. We actually can do all that traditionally right from the facility. But our philosophy is a little different than most primary cares, especially today. We like to spend time with our patients, and we like our patients to use the least amount of pharmaceutical necessary to keep them safe and correct the medical challenge. How is that done? That's actually where the nutraceuticals come in, or the natural products, and the delivery system we like to use is hydration.
And why is that?
Because we're able to really get the appropriate therapeutic level. We're able to use the particular nutraceuticals and the constituents of those nutraceuticals that can effectuate the change. And we're able to do it in a fairly complete and fairly quickly.
This is one of those things where people know about it, but they don't notice it. Like I had eye surgery the other day.
Oh, yeah.
And
this
the first
is good.
thing they said was, "Oh, we're going to put an IV in you." Okay,
Right, of course.
so,
of course.
But every time you go to the hospital or a surgery
center or
anywhere, you get an IV.
Emergency room, of course you are, because it's the best way to deliver many types of medications as well as the natural products, and to deliver them in the dosing that's appropriate for whatever the procedure is. And here's the thing, John, that's interesting. I find it more interesting that you had your surgery on Wednesday. You were in Tuesday.
And I was in Thursday.
Right, you were in Thursday. Now, you know and I know they gave you a list of things you shouldn't take, right? Because
yes.
you were having cataract surgery.
Yes.
No big deal.
Right.
You know, it's age related.
Right.
You work hard, you're always reading, etc. So bottom line is, we did not put you at risk for that surgery. When I knew you were having that, what did we do? We extracted some of the products that might thin out the blood.
Right.
Right? So when people come into me and say, my doctor said I have to get off everything for 12 days to have this done because, it'll interfere and they might have to give me an IV and it might cause bleeding. Yeah, it might, but chances are if you come to a place like ours, it's not going to happen.
And it's interesting because I had the surgery Wednesday and Thursday I had a follow-up with the doctor.
Yeah.
And my vision was in the right eye was 20/30.
Yeah, there you
which
go.
Before it was like
20-0, right?
20-0.
That's right.
That's
right.
So that goes to show you.
Not only that, I'm fairly confident that we helped you along the way, because what was happening is, if you think about it, we were helping the healing process.
I think it's important for you to tell us how you got to this point of why hydration and why you started your practice, because you were in traditional medicine.
I was listen, I'm a biochemist by trade, I like to say, right? Bottom line, I was working clinical chemistry and running clinical chemistry for a large organization in Philadelphia. But the bottom line was, I myself had a challenge, and I realized that the traditional treatments, although good, and you'll always hear me say, don't throw away your medication, don't discount traditional surgeries, don't discount traditional treatments. However, use them wisely. And there are many ways to augment that kind of thing, help you get through whatever challenge you have in a way that doesn't deplete the rest of your life. And that's the key. The key is, our belief is we want to give you quality of life until the very end. And I can't think of a better goal.
And your challenge was a serious one.
Well, yeah, of course.
Point, yeah.
And I had surgery, and I looked around to get the surgery done with a surgeon who would do it. By the way, he's no longer with me because he said I made him smoke himself to death. But he was a great guy. And maybe I did. I don't know, because I was a little particular. But bottom line was, I believe that there are many ways to approach a problem, and we shouldn't get stuck in the black box. In other words, don't just say, this is the only way, I went to one guy, that's it. Nah, there's a million ways to skin a cat.
Hydration is the cornerstone of your practice.
What we do.
And the
nutraceuticals
right.
are actually the important piece. So they're the same kind of vitamins, minerals, amino acids, polypeptides, things like that are naturally found in the body is what we want to replenish your body with.
The $1 million question people always ask you, does it work?
Does it work? Well, John, I tell you what, I just said to somebody this week who came up from Delaware, I went in on Friday because this patient sounded like he really needed me. I like to take, I go really somewhere else on Fridays usually to work, and I work down at a mission here in Atlantic City. So I decided to come in for this particular patient, and I did, and I said, he says, well, I don't know, does it work? I said, well, come on. And I brought him out to the clinic. By the way, we had about 8 people there on Friday,
right.
Okay? And they know that's our short day. And I said, ask all of them. And I'm going to tell you right now, they were smiling, they were happy. It was so far removed from a chemotherapeutic situation that you can find, because he was a little worried about how the clinic was set up. And I said, talk to them and let me know, does it work?
So that's the bottom line, because
I can show them things, I can show them quantitative data, but in the end, the real key is, how are you feeling? How's the disease progressing? we can't cure many of these conditions, right?
But you can improve the quality of life.
We can improve your quality of life,
right.
and we do.
All right, we're coming up on our first break of the morning. Our program is called Health Watch, and you'll find us here every Sunday from 8 till 9, the live version, here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. We've told you so far about the who, what, when, where, why, and how of Innovative Medical. Now we're going to get into some situations that can really help you understand what Dr. Molly does. And again, if you have a question or a medical challenge you want to run by her, 855-839-1210 is our number here, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return. More of today's Health Watch after these words. And we're back here on Health Watch. Operators standing by right now at Innovative Medical Associates, as they are every week when we're on the air. 856-489-0505 is the number. 856-489-0505. You call, you get some information. You want to make an appointment to sit down with Dr. Molly. The initial consultation, remember, is complimentary, and that's really where you can get a lot of good information. And you see the clinic, and you can talk to some of the patients, as you heard Dr. Molly say earlier, and one of them is me. So if you happen to be there on a Tuesday or Thursday, you'll talk to me. How's that? 856-489-0505. 856-489-0505. That is the number. Innovative Medical Associates, Marlton, New Jersey. And also the website has constantly been updated. And in fact, a lot of new features on the website this week were put in. So you want to check that out. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com is the website. And our show is called Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. You got a question for Dr. Molly or a medical challenge right now, you can call in at 855-839-1210. We thought, Dr. Molly, that because it's Mother's Day, you'd focus on women's issues, and in particular, autoimmune. And you told me before the show, I thought this was really shocking. Women make up like 75% of your autoimmune patients.
That's right. And that's really a universal statistic. So it's not just in our clinic,
it's
but
all over. Okay.
It really is. And there's over 24 million Americans suffering from autoimmune diseases. And you and I spoke a little bit about that in terms of our lymphatic system last week. So I think it's appropriate to talk about why this is important. But why is it that women suffer more from autoimmune disease than men? Well, this is one of those tricks. Women tend to appear to mount a larger inflammatory response than men. So again, I'm back to our old nemesis, inflammation.
Yeah, you've said it many times.
Many times. And so as a result of that, they tend to then develop more autoimmune type of symptoms. Now, what's interesting is it would seem to me that the sex hormones have something to do with this. If more women, it would appear that obviously there's a connection, because we all know men and women are different. At least we're born different. Let's put it that way. Okay. Men and women are different. I want to be politically correct. And why is there a response? Well, we can assume that it has something to do with the hormonal cascade for women as well as for men, but in different ways. So women, it seems, have something called DHEA. Men do too, but it tends to be lower in women. DHEA, and that is a steroidal type of hormone, and it's produced in the brain, in the reproductive organs, and the adrenal glands, more importantly. How many times have I had women come into my clinic and say, I know I have adrenal fatigue, not an adrenal condition that the traditionalists would say you have, like Cushing's disease or one of those. No, adrenal fatigue, which would be like a subset of the adrenal disease state. So I say, well, how do you know that? Well, a doctor measured my DHEA and told me that it was low. Okay, great. So what did they do for you, and how did they stop your fatigue and all the problems that you had? Oh, they prescribed DHEA and bioidentical hormones. And I say, okay, I can live with that. Tell me a little bit about this and tell me how it's delivered. Well, Interestingly enough, there's a delivery system out there that actually inserts these hormones directly into the body. You would think that's great, except you can't always relegate, you can't delineate sometimes how to dose those. Why? Because women have a very interesting hormonal rhythm, right? They have things like pregnancy that they have to worry about. They have things like menses that they have to worry about. And so it's a very different type of thing of just delivering the hormones. You really got to figure out how to do that. And then this is where we come in as well. Then we have to look at other causes of the inflammation.
Which would be what?
Well, we can go to this again. Nutritional evaluation is very important in these autoimmune diseases because the hormones alone don't tend to solve the problem. And how do I know that? Because people come into me, women have come into me after being on a hormonal regimen of injected hormones and not feeling well. And not only do we then have to rerun the entire hormonal panel, we have to look at what other things are causing them to have the symptoms of these autoimmune diseases.
How do you treat, I mean, I know you have a lot of autoimmune patients. What's kind of and I know everything is not one size fits all. Right. What's kind of the general treatment protocol that you have to help women with these autoimmune problems?
Well, one of the things we would do is immediately I would look at the hormonal levels, obviously. And I would look at that if they are taking hormones, I want to know what form they're taking because we have a particular propensity for using these in the mucosa, meaning between the tongue and the cheek, and we like to put them in something we call a troche. So our docs are very familiar with how to prescribe those. So that's one of the things we would do. But I have to tell you that there's more to this. We'd also have to look at evaluating their nutritional needs because, again, we're back to things like what do the hormones need? Remember, hormonal patterns work through certain pathways. So what I want to know is what is effectuating those pathways to cause inflammation throughout the body.
What do you tell people when they come in and they say, Dr. Molly, you kind of determine, that they have an autoimmune problem? Besides the hydration, what else do you kind of recommend that they do?
Well, at that point, what we will do first and foremost would be the hydration to deliver the particular antioxidants that they need to hold down the inflammation in the moment, depending on what kind of condition. They may need to go on something like bioidentical hormones, which we could prescribe. In particular, this is interesting, John. I have a physician who has MS.
Yes.
And God bless her. We were sitting together, and we had a third physician in there who actually was an expert in men's health. This is interesting. He came down to visit the clinic. And he was talking, and he said, this is like 5 years ago, he said to Dr. Pat, isn't this interesting? He said, didn't they ever want to put you on estriol at the minute they decided you might have MS? And she said, no one in the traditional level ever discussed putting me on anything. And he said, oh my goodness, in the very beginning, that would have been the first thing I looked at. Now, he's an old timer. In fact, he's retired now, which is why he was coming down to the clinic to talk to us. But what I found interesting, and he went on to say, yeah, everything that we know about the anti-inflammatories, etc. But all this would do is be a little bridge in between what you're taking here and whatever we're doing now. And I'll tell you, it was the best advice I ever got because I listened to that and then I started to do the research. And I'll be darned if they didn't come up with something in 2018, this is way after he came in to see me, showing that in things like MS and Sjögren's and lupus, there may be declines not only on the DHEA, but also in the estriol and estradiol.
It's also hard to diagnose, and it's also, in a lot of cases, you've had patients who've come in and said, well, my doc said there's nothing I can do for you anymore.
And that's
it's a difficult challenge, isn't it?
Because it's a complex challenge. And interestingly enough, most people who come in already have a diagnosis of some type of autoimmune from the traditionalist. It's just that they don't get any relief. Okay, the relief is actually worse than the condition itself, like the injectable drugs and those kinds of things. And many of my patients do not want to be on that. And I think I applaud my medical team for looking at that and saying, there's a better way to handle this, and we can do it. And again, we do it through the hydration, utilizing anti-inflammatories and some specialized nutraceuticals, depending on what condition the patient comes into. So when we look about how this complexity is, we went through this last week when I talked about the lymphatic system, and the lymphatic being sort of the soldiers in our body to move our T cells, et cetera, out there to make sure that the white blood cells are tuned up enough that they can go do the work. Well, sometimes they go into overdrive, right?
Okay, let's stop right there because we're coming up on a break.
Okay.
We're at the halfway point, so we're gonna pick that up after the break. Okay. It's Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We are discussing autoimmune challenges, and if that's one of your challenges, certainly you can call in and ask a question of Dr. Molly, or if you have any particular medical challenge, 855-839-1210 is our number here, 855-839-1210. With Dr. Molly Fantasia, I'm John DeMasi. More Health Watch after these words. Welcome back to Health Watch. As always, when we're on the program, operators standing by at Innovative Medical Associates. And just because we leave you at 9 o'clock doesn't mean they go home. No, they're working on Mother's Day, okay? 856-489-0505 is the number. 856-489-0505. You can call today or you can call tomorrow, whenever, but that is the number for Innovative Medical Associates located in Marlton, New Jersey, 856-489-0505. And I also encourage you to check out the website, innovativemedicalassociates.com, innovativemedicalassociates.com. A lot of things have been added, especially this week, to the website. So you really can get a good feel for what Innovative Medical is all about. Check it out on the web, innovativemedicalassociates.com, innovativemedicalassociates.com. And our show is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly's been talking about, in honor of Mother's Day, autoimmune. And we kind of stopped in the middle there, so pick up where you left off.
What I would like our listeners to get away or to take away from this is actually something that I think is important. Yes, adrenal stress is something that we have to work on. So again, we test for that. Hormonal levels are things we have to work on. We test for that. But when you think about all of this and looking at this in totally, in order for us to optimize a autoimmune patient's quality of life, we have to make sure that we deliver enough nutrition so that those particular pathways that I spoke about earlier can be maximized. And we need to do that by delivering through hydration things like our old friend vitamin C, because we need to have the high doses of anti-inflammatories to help hold down the inflammatory process that really starts in all the autoimmune diseases. And then, depending on what areas of the body that are affected, we then actually look at that, look at the patient, and then we tweak the recipes for the particular disease and for the patient. So again, this is not a one-size-fits-all patient remedy. We have to look at what kind of autoimmune diseases are happening. Now, one of the things I want to tell everyone out there who has autoimmune, they've really got to look at their digestion. I'm back to what? The intestines, the gut, has a lot of lymphocytes. It has a lot of lymphs in there, meaning the lymphatic pathways. So if that's not maximized, you definitely are going to have feel like fatigue, and you're going to feel stress, and you're going to feel all those things we talked about last week.
Yes.
So this is a very big part of what we do. So obviously, in a lot of our autoimmune IV treatments, so to speak, or let's say, I don't want to use treatments, I want to use the term protocols, we actually are helping people tune up their own lymphatic systems so that the body can go back to homeostasis, which is what? My Goldilocks theory.
Absolutely.
Everything has to be just right.
Do you work with the patients on their diet? You mentioned that
Right,
do you
right.
tell them, listen, you can't eat this, you can't eat that?
Not only that, we have to look. Remember, one of the autoimmune diseases that nobody speaks of as an autoimmune disease is diabetes. It's an autoimmune disease. And again, it's the kind of thing we need to look at what patients are ingesting. And we have the greatest gal in the office. We will help you with your supplements as well. But I'm going to tell you, you realize that everything you ingest through the mouth has to go through the liver. Well, in the autoimmune state, for the most part, liver is sort of compromised. That's why hydration can help you get to a quality of life much quicker.
So it's a comprehensive approach, as you do with many conditions and challenges.
Right.
The hydration plus supplements.
Plus reviewing of the laboratory work to see if we have to get the medical directors involved in ordering the bioidentical hormones, both for men and women, more importantly. Because how many women, interesting fact, because it comes to me as we're talking, interesting fact, I had many women who come in with certain autoimmune diseases and say, wow, when I was pregnant, I felt the best. And I'd say, really? Why do you think that? I don't know. I said, you think it was the anticipation of motherhood? Well, yeah, I agree with that. But it was more than that. It's because our hormones were working overdrive. Things were going on, right? Think about it. So during the pregnancy, you have a different surge of hormones, and that sort of counterbalanced some of the issues that were going on in the stealing of the DHEA.
I was going to ask you, you mentioned it earlier briefly. You talked about women's issues. Does it have to do with the reproductive issues that 75% of autoimmune are for women? Is that?
Well, it's all of the hormones, and they're not just in the reproductive tract, John. They're in our brain. They're in our intestines. They're everywhere for men and women. But women have a more complex system. That is the issue. And a lot of that, again, goes back to what I was talking about earlier. We have more rhythm in our bodies, meaning we have the periods of time where we actually have the menses. Then there's also menopause. Very different. Now, men do have something called andropause much later in life and much easier to correct. And we have proof to do that in terms of quality of life correction for men. I have a ton of guys who are on our andropause program and don't even know it. They don't know it. They just come in for their regular IVs and think they're feeling great, and it's great. But again, we're augmenting with hormones. So there are many, many things we need. We need to look at thyroid. I had a wonderful medical director who's no longer with us. She was a big proponent of thyroid. In particular, she liked the shorter acting thyroid, T3, for women over the age of 55 or 60. She believed all women at that point had a reduction in their thyroid, which is why they got a little plump around the middle, etc. So there's a lot to talk about. And the thing is, what happens is each and every one of these autoimmune conditions are distinct. They have distinct kinds of, let's say, symptoms, but they share a lot of the same symptoms, including fatigue and some other things.
All right, we're going to go to the phones. We have Dan in Haddon Township. Dan, good morning. You're on Health Watch with Dr. Molly. Welcome to the show.
Hi, Dan. How you doing?
All right.
Good.
Dr. Molly, what would you prescribe for a person with the low-grade ovarian cancer with the BRAF V600E gene mutation?
Mm-hmm. Well, first of all, let me put it this way. I don't prescribe, okay? So one of my physicians would actually be doing the prescribing. How I would treat how she's doing right now. First of all, may I ask a question? Has she had any conventional treatment?
She's had surgery
Great.
Once in 2013, once in 2018.
Okay.
We refused chemo, and now she's NED. No evidence of disease right now.
Excellent. Excellent. Guess what? I can relate to that more than you know. I think you guys were very smart, and you'll hear me say it over and over. Get the affected organ out. So that is wonderful. So you remove the cancer. I would suggest utilizing the vitamin C, anti-inflammatories. I have several homeopathics that we might want to use in addition to that are not readily available, that people don't know about, and you really have to come in and talk about that. But there are many, many other nutraceuticals I would use. In addition, I would look at giving her some beta glucan and the extraction from the mushrooms. Is she taking any kind of nutritional supplements right now?
Yes.
Well, give me a little FYI.
Amygdalin, it's like a laetrile from paper
Yeah, good. But you see, that's very hard. Yeah, okay, that's good. You know what that is. That's from apricot. Go ahead. Very good.
What else, Dan?
What?
Potassium potassium ascorbate.
Sure. Yes, good. How did you get this? Let me ask you this. You obviously have already spoken to somebody who's in integrative medicine, because you didn't pick up on the amygdalin without it. So talk to me a little bit. Did you do your own research, my friend?
Yes, on the internet. No doctor.
Dr. Google. All right. Listen, I applaud you. There are many, many things similar that you're taking right now that we would deliver through the hydration in possibly a more, let's say, more accurate therapeutic dosage. Okay, we could enhance what she's taking. That would be what I'm telling you. So yes, I would definitely call the office. You guys are close. You come in for the free consult, because I already think you're a smart guy, and I think we can keep your wife out of any other trouble.
Yeah,
God
Dan,
bless you.
Feel free. Thanks for the call. Feel free
Dan,
to call Dr. Molly.
This
in
was
the
a
office.
wonderful.
I know you can help.
I know.
That,
I would like to talk more freely. I would like to talk more freely,
Right,
Dan.
okay.
God bless you, sir. Thank you.
Feel free to call Dr. Molly in the
Thank
office
you.
and set up
Thank
that initial consultation. I think it'll help you out.
That's very interesting, though, because he went right for some of the particular alternatives. The question is, you want to use those, John, and cancer being such a difficult, and I believe cancer is a response, an autoimmune type response to inflammation, as you know. I believe that. It isn't scientific evidence. I can't say people have that philosophy, but in our clinic, we believe this. The thing that I worry about, and I think I applaud Dan for what he has done, the thing I worry about is you want to use some of these nutraceuticals that you're getting, from the internet, etc., in an appropriate way, and use them in a mix that they're not competing with other nutraceuticals. So that's extremely important.
All right, we're coming up on our final break of the morning, which means you still have time to call in if you have a question or a medical challenge you want to run by Dr. Molly. 855-839-1210 is our number here in the studio, 855-839-1210. Our show is Health Watch. Dr. Molly Fantasia is here. Every Sunday, we're here live 8 till 9 on Talk Radio 1210 WPHT. With Dr. Molly, I'm John DeMasi. Some more information on today's edition of Health Watch, our Mother's Day edition, after these words. Back here on Health Watch, operators standing by right now at Innovative Medical Associates. And don't forget, we leave you at 9, but they don't. They're there, okay? And they don't know holidays, all right? 856-489-0505. 856-489-0505 is the number. It's Innovative Medical Associates, Marlton, New Jersey. And don't forget, you can check out the web, and a lot of good information on that. And I've mentioned this a couple of times, that there's been some new information put on the web this week. So you want to check that out, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And also, don't forget, if you missed any of this morning's program, we have our Health Watch replay this afternoon from 4 until 5, right here on Talk Radio 1210 WPHT. Couple minutes left of the show. You still have time to jump in with a question, if you like, for Dr. Molly or a medical challenge at 855-839-1210. I know you want to kind of go over this. We've been talking about autoimmune, and there's a variety of autoimmune.
Right, and we've seen plenty of them in art. And the thing I want to really put out to people is, remember, you don't have to test fully the autoimmune panel for a particular disease to have a subset of that disease. You may only test one or two analytes might be off, but guess what? If your symptoms are the fatigue, if your symptoms are the muscle weakness, if you have the symptoms related to that particular condition, it is warranted for you to come in and talk about that, because we can help you. How many people were told, go home, it's in your head, because you don't test positive on every single analyte for a specific disease? Doesn't mean you don't have inflammation. Doesn't mean this isn't going on. So I want to start with that.
Real quick, I remember a story. You had a patient, and I was in the clinic the same day, and she's telling me the story. Now, she's in her 40s at this particular time. She's got 2 kids, young kids, and she said to me, they told me there was nothing more they could do for me. Right. And ever since I've been coming here, I feel much better. I can take care of my kids. Before, I couldn't do anything.
You know what? This is normal for our clinic, because that's one of the cases. They insisted this woman did not have an autoimmune disorder. And clearly,
it's in your head.
Right. Well, clearly it is probably hormonally regulated and inflammation. So, John, one of the things that I think about too, because we have an interest in this, women in particular, when we talk about alopecia areata, you know, that's where it attacks your hair follicles, and you may have patchy hair loss. Well, you know, conventional physicians think, oh, well, it's no big deal. It's just, you know, it affects you cosmetically. I don't believe that. I believe that's a symptom of what's going on in the rest of you. So, yeah, we got to look at that, and we got to see, do you have other inflammation? You bet. In 9 out of 10 cases. And this is interesting because men have not just baldness, as in male pattern baldness, but they may have this condition. And of course, it's completely overlooked because it's not normal in men.
Right.
Okay. So, you know, I'm given equal time. Also, celiac disease is another one I've seen. Oh, it's just I have a little allergy or sensitivity to food. Well, yeah, you have to gluten, but it's not the gluten alone. You're having some type of systemic inflammation in the gut. Well, if your gut's affected, what do you think else is affected, John? Your lymphatic system. Everything's affected. That's another one I see a lot of. Of course, I see, how about diabetes? We briefly touched on that. People think, well, that's just a blood sugar problem. You know, no, that is an autoimmune disease because the immune system's attacking the cells that make the insulin. Guess what? You have a problem with that. You have a problem in many other systems as well, you know. And I want people to take their diabetes seriously, and we have plenty of protocol to help in that regard. Thyroid conditions, Graves' disease, another one we can help with. And we say, and they go, oh, it's only your thyroid. Let's just, you know, take it out. Everything's going to be fine. No. You have some type of dysregulation. How about MS? How about Sjögren's? How about scleroderma? I started the patient with scleroderma.
We talked about that.
And boy, she's got plenty of problems. And guess what? Each and every one of the 3 that I just mentioned, we can utilize a low dose, subclinical dose of a particular pharmaceutical.
Which is your philosophy. You try to use the lowest dose possible.
Right. And it helps people. How about rheumatoid arthritis? This week I'm working with Sandy, who you know and she is one of the patients that has tremendous autoimmune problems. And, you know, I'm working with her and putting together another type of intervention utilizing the MSC cells, which have the growth factors, the cytokines, and have the peptides that I'm going to be using with her on Wednesday. So we have things like a hepatitis that is in particular, and autoimmune hepatitis, where the liver starts making its own antibodies to itself.
Bottom line, any autoimmune issues that you have, feel free to call Dr. Molly.
Amen.
Call her in the office.
I know I have too numerous to count.
Exactly right. And we'll have another show next week, so you'll continue.
Thank you, John.
That's going to put the wraps on this edition of Health Watch. Don't forget, operators standing by, and they'll be there well after we leave you at 9 o'clock, 856-489-0505. That's the number. If you don't call today, you can call tomorrow. It's the same number, 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. Don't forget the web, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, you can catch our Health Watch replay this afternoon, 4 until 5, here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, Joanne, and our nurses Jess and Lana, and our medical assistant Karen Kathy, I'm your host, John DeMasi. Thank you for listening. Happy Mother's Day, and have a great week and a healthy one. We'll do it all over again next Sunday, Health Watch, 8 till 9. Talk Radio 1210 WPHT. You take care.
This program is a paid commercial announcement and in no way represents the views of WPHT or its management.